So I actually want to talk with you a little bit about philosophy. We're going to, we've given you lots of information, I think, in handouts about the details of the House proposal, the American Health Care Act, to repeal and replace the Affordable Care Act. We've given you, I think, some detail on what could be done to repair the Affordable Care Act, some of the regulations that Peter just talked about, and some other things that could be done from a health insurer's standpoint. We can talk about those in the questions. But I think it's fundamental, first of all, to understand what is underlying both the Affordable Care Act from a philosophical standpoint and also what has been underlying the American Health Care Act, ACA, from a philosophical standpoint. Because I think it will help us understand where we are today, where we possibly could be headed, and what some of the challenges are. So to do that, I think we have to go back to 1994, when the Clinton health reform failed. And when that happened, it wasn't the case that the Democrats at the time decided that, oh, well, we're done, forget it, we'll think about health care on another day. Indeed, they spent considerable time retrenching and thinking through where they wanted to go on health care ever since the failure of Clinton reform, and of course long before that. Democrats may have many different views on how you get to universal coverage, but they are all indeed united in the concept that we should have universal coverage as a country. And sort of going back to Rich's last points, the Democrats are quite clear in their belief that health care, particularly in this case, I am going to talk about health insurance because that is the issue of debate at the moment, that health insurance is a social good. So they are united in that view, even though they had many different viewpoints about how to get to that goal. In the mid-90s, when Clinton health reform failed, there was a Republican proposal that was put on the table by the Heritage Foundation. At the time, it was considered extremely conservative. It is the foundation for the Affordable Care Act. Heritage Foundation has moved far to the even further right. Since that time, they now sort of disown that idea, but it was their proposal in the mid-1990s. And at the time, the Democrats really opposed the concept because it was based on the philosophy of individual responsibility, right? We should all buy health insurance the way we all are required to buy auto insurance. But they became pragmatic, and they had the idea that, well, this was something the Republicans put on the table. We have a goal to get to universal coverage. It won't quite get there. They were quite clear that the Affordable Care Act would not achieve universal coverage, but it would get us closer down that path. It was an incremental, but significant incremental improvement down the path of universal coverage. And so they actually believed that if they adopted the Republican ideas, they would have a bipartisan approach to health care reform to lead us to universal coverage. Oh, they were so wrong. But they did not envision the kind of Congress they would be dealing with in 2009 when they were thinking this through over the 10 years or more between the Clinton failure and Obama's election. And so, of course, they moved down this path. And from that perspective, it is important to understand that the Affordable Care Act is based on this concept of making the market work better. That is what the changes in the individual market were all designed to do. There were tremendous market failures all across the country. The idea that the individual market before the Affordable Care Act was great is totally false. It was a market that was in a death spiral in many places if you could even get coverage. And so it was intended to strengthen the market. It has a very fundamental core to it that is a market-based approach. But it did something else philosophically that is also very important to understand in the context of today's debate. It changed the foundation of Medicaid. When Medicaid was first adopted in 1965, it was adopted on a very different philosophical framework than Medicare. Medicare, an entitlement program, you're 65, essentially you're eligible for Medicare. That is not the foundation that Medicaid comes from. Medicaid was instead based upon the poor laws in this country that go back to the 1930s. And in that framework, we wanted to help people who were indeed in poverty, but not everyone in poverty. We wanted to help people that were deemed the worthy poor. So you had to be not only poor, but you had to also have something else. You had to be categorically eligible. You had to be old-aged, blind, disabled, a parent with children, various categories that you could fit into. But many poor people were left out of Medicaid before the Affordable Care Act. Indeed, in Michigan, 34% of those who are below 100% of poverty were not eligible for Medicaid before the Affordable Care Act. The Affordable Care Act fundamentally changed that philosophy behind Medicaid, making it more like an entitlement program similar to Medicare based on income. Anyone below 138% of poverty would be eligible for Medicaid, is eligible for Medicaid in those states that have done the expansion. Of course, the framers of the Affordable Care Act did not expect this would become an optional thing where some states were in and some were not. That was a Supreme Court decision. But the philosophy was that Medicaid would be based on income and not based upon this categorical patchwork. So that is the framework and the philosophy behind the Affordable Care Act. ACA, the Republican House bill that did not get voted on March 24th, may or may not be coming back. We'll see, hard to know. Things do change frequently, but not quite dead yet. But that piece of legislation is built on a variety of frameworks. Because while the Democrats were united and continue to be united in their view that we should have universal coverage in this country, the Republicans are not. And in fact, when the Clinton health reforms died, the Republicans did not spend a lot of time on health care or health policy. This is not their primary focus. And they have not coalesced today, never did, and have not today coalesced on a single philosophical framework. In fact, they're quite divided. So you have the moderate Republicans who, if you could get them out of the very hyper-partisan environment we're in today and could really sit down with them privately, probably think the Affordable Care Act is a pretty good law. They might do some things differently, they would make tweaks to it, but the core of it, they would acknowledge, is a market-based law that is designed to make the market work better. And actually, you have Republicans like Governor Snyder who have said things like that. And so we do know that there is a core who believe that we could change things at the margins, but that there should be universal coverage, that we should move down that path. That's the moderates in the House, moderates in the Senate. But then you have the Freedom Caucus. And the Freedom Caucus has an entirely different philosophy. They are on the wavelength that says the government should not be in the business of providing health insurance. It should be left to the market. And maybe they're willing to do some things to make the market work a little better, although there's some debate about what they would do to make the market work better. But essentially, they believe healthcare is not a social good, it's a market good. So there are moderate Republicans who believe it is a social good, and they want to change things around the margins. There is the Freedom Caucus who believes it is, in fact, a market good. And then you have Paul Ryan. And I put him in a different category because Paul Ryan agrees, I believe, really with the fundamentals of the Freedom Caucus, that healthcare should not be a social good but should be a market good. But he even goes beyond that because he really wants to end entitlement programs. He has for a long time had a goal to change Medicare from a defined benefit concept to a defined contribution, give seniors money, let them go in the marketplace, let them buy coverage, and make the market work in that way. And so he, in ACA, tried to really start to insert this viewpoint with regard to Medicaid. And so he really wanted to not only repeal the Affordable Care Act, but fundamentally change Medicaid for all people who are enrolled in Medicaid, even those enrolled prior to the Affordable Care Act, in a very fundamental way. And so that is why you have a bill that came out, ACA, that has, frankly, no core philosophy, because it tried to appeal to all of these groups. It tried to do things that were to buy in the moderate Republicans who really want some form of universal coverage by keeping some tax credits and keeping some amount of Medicaid. Well, then the Freedom Caucus didn't like those things, and so now what the discussion is, well, maybe we'll pull out the essential benefits because they have to give more to the Freedom Caucus to say it's going to really, over time, repeal the Affordable Care Act. And again, then you have Paul Ryan saying we really need to fundamentally change Medicaid. That is what was embodied in ACA and why they could not get it through the House. And so all of the discussion that is going on today and that you see surfacing in the paper with Mark Meadows, who's head of the Freedom Caucus, saying, oh, we're going to cut spring break short, we'll see, and we're going to bring everyone back for a vote because we're really very close. Well, the fundamentals haven't changed. There is deep division in the Republican side on what core philosophy they want to have when it comes to healthcare reform. And this is the challenge. Now, what I said yesterday to our students is what I worry about on the regulatory side, Peter's point, is it is also quite unclear within the Trump administration and the presidency what the core philosophy is at all on healthcare. We do know what Tom Price's philosophy is, the Secretary of HHS, and Seema Verma. Tom Price came out of the Freedom Caucus. He's definitely on the market side. Seema Verma consulted with the Indiana Medicaid plan. We know what was happened with the Medicaid plan, so we know their viewpoint. But we don't know what actually the president and his advisors are, because they're literally all over the map in terms of the advice that they're getting and what the statements that they're making. And so I think they could very well simply not have any strategy on healthcare, but bumble through into creating a failure of the market. So we will see, and with that, I turn it back to you.